Hey guys, and welcome back to my channel. You guys won't believe what just happened to me, okay? It is literally 2 a.m. and I made a whole video. It was like 17 minutes long, and I was like dressed in an outfit and I was showing you guys my body and stuff. And the whole video was recorded in slow-mo. I don't know what I did. So long story short, I'm deciding to refilm it really quickly for you guys. I'm now in my bata, my grandma dress, but I will upload some pictures for you guys. You know, I always do show you guys pictures and stuff like that, and I got some videos for you. The point of this video today is just to answer some questions that you guys have been asking me, and also I want to show you guys, remember from the first videos I was making, I was talking about the dog ear. Remember how like just horrific that left side looked? I want to show you how it looks now, just 2 months later. So much better. It's not a dog ear. It's been healing so amazingly. So I just want to give you guys an update. I'm going to try to do a side-by-side of it to show you guys what it was looking like 6 days after. I found a video on my Instagram of what it looked like 6 days after, and now I'm going to show you guys what it looks like 2 months after. So I'm about 12 weeks post-op. And I'm going to show you guys just the drastic difference, what it looks like. I mean, I was horrified in the beginning. I was scared. I thought that I was botched. Do you guys like my purple lipstick? I put it on for you guys. Anyways, I thought I was botched, and I was like, this is not right. But I just want to let you guys know, trust the process. Follow your healing instructions to the T. A lot of people don't follow post-operative care, and that's why things go wrong. Take your antibiotics. Don't stop. Set a reminder. Leave notes around your house if you need to. Write it on your arm if that's what you have to do. Drink lots of water. Drink lots of water, okay? There's something called arnica tea, which you also could drink. It's a healing tea, so it's supposed to help with healing from the inside, okay? So Google things that you can drink that helps with healing wounds on the inside. There's something else, it starts with an L, like Lucinge. I don't know, I'm gonna find exactly what it's called for you guys, and I'll let you know. But take care of yourself. Make sure your wounds are clean. Wear gloves. So that's, again, another part of the video. Wear gloves. Make sure you're wearing gloves whenever you're touching yourself. Have a sanitizer. I have a huge sanitizer with a pump, and every time I'm putting on gloves and sanitizer. Clean yourself twice a day. When you wake up in the morning, clean yourself. If you can't, have somebody try to help you, you know, put on some gloves, have them put on gloves, clean your wounds, put ointment, antibiotic ointment. That's another thing you're gonna need. Make sure it has bacitracin in it, because that's a tricky word. But that's an ingredient that's supposed to be really good. In the next slide, I'll show you guys just what you guys are gonna need, and I'm gonna talk briefly about it, and I'm gonna tell you guys that I look horrible, and that's why I'm not showing my face in the video. But however, I decided to show my face. That's why it took me a long time. Because as a mom, you know, it's hard to find the time. I wanted to do my makeup for you guys and kind of look decent. You know, you gotta find quiet time when the baby's sleeping and stuff. So yeah. And I don't know if you guys can notice, but I have on 2 different lashes because I couldn't find a pair. And I normally get my lashes done. I normally get my lashes done, and I'm looking up when I should be looking at the lens. I always do that. So anyways, I normally get my lashes done, and I don't have them done. For this video, I wanted some lashes, so there's my story. Okay, back to what matters. This is what you guys are gonna need. Gauze. Rolled gauze, okay? Specifically rolled gauze. Make sure it's rolled gauze. I'm gonna open it up and show you guys. There you go, rolled gauze. And I'm gonna go ahead and just forward to the next slide where I show you all the things you're gonna need. You're gonna want to make sure you use like stool softener so that you poop before you leave, because you want to make sure that you poop. Alcohol swabs, lots of alcohol pads, because you don't want to touch yourself and be dirty, you know, just to maybe wipe around the wounds or the wound areas when you come home, because when you come home, that's when your bandages will have been removed. So I say that you don't really need much of this stuff, because for the most part, your bandages are going to be on during your stay. Your bandages won't probably come off until you come home, and then they're going to rewrap you anyways. So you're gonna need lots of rolled gauzes. Like I buy these by the boxes because I try to clean my wounds twice a day. I had a tummy tuck and I had some issues with healing. So that's why I just kind of bought a lot of gauze, and I was like making sure I was cleaning myself. So along with alcohol swabs, gloves. Like I have really long nails now, but of course I didn't have that prior to that. And I make sure that I wear gloves when I'm touching myself. This is something that Mia Aesthetics recommended to me. So it was because I had a lot of burning. So if you can see the name of it, 1% silver sulfa, whatever that is, cream. If you notice that you have any really black, dark marks, it looks like burning, this is a cream that maybe you can ask them to prescribe to you. And it worked really, really good for me. This was also an antibiotic ointment, polysporin, anything with bacitracin ointment is really good. This is a triple antibiotic ointment. Again, it has bacitracin and zinc, so that's really good. This was a Gold Bond thing I bought quite recently. It's has lidocaine. It's just like a pain and itch relief. I wouldn't recommend spraying that on your wounds. Maybe just some itchy areas on your skin. Because when you start to heal, you will have itchy areas. This is also something that I used. I tried using tea tree and Manuka honey balm. I found this when I went to Vegas. I know Manuka honey period is just really good for healing. And this is a Arnica cream, which is just for like a massage. I just rubbed it on my body, so it helps with like bruising, or if like, you know, you're in pain and things like that. But yeah, I'm such an idiot. I don't know what I did to the last video. It was so good. Like, I'm like, I can't recreate that again. So I'm trying to remember everything I was talking about. Oh, boom. I want to answer some of you guys' questions. So I'm just going to read. Someone asked me, hey, I'm 6 weeks post-op, tummy tuck with Dr. Mejio, and boy, oh boy, wasn't prepared for the aftermath. Yes, I'm not going to lie to you guys. People say, oh, the first 4 days, the first week. No. The first 6 weeks for me, like I cried up until the 6 week mark. Like it was excruciatingly painful. Tummy tuck, like you're gonna be hunched over for a while. Don't force yourself. One day you're gonna wake up and you're literally gonna just be able to stand. So don't force yourself, you know, and make sure you're just taking care of yourself. Make sure you're drinking a lot of water. Make sure you're eating. If you don't have an appetite, like me, I didn't really have appetite, drink Ensures. Make sure you're drinking Ensure. You're getting your nourishment. Make sure you're taking vitamins. Something good to take is zinc. My mom told me to take it, so Google it, see why it's good. And my massage therapist told me zinc. Maybe things with iron, because I know your iron is probably going to be low as well after surgery. So I know it's going to be tough, guys, but like watch my videos because it's going to help you. I cried all the time. It's fine if you have to cry. Like, you're going to get through it. Push through. And I say this to say, you know, I don't really want to show everyone my personal, like my wounds and what it looks like, but I'm doing this for you guys because I wish somebody would have did this for me to show me the real, like what this really is going to be like. So that's why, again, I'm going to upload the video of what it was looking like 6 days after surgery, and then you guys are going to see now what it's looking like 2 months after. Such an improvement. So just trust the process and give yourself time to heal. Just give yourself time to heal. I mean, me, like when I came home from Miami, I went to the emergency room. Like that's how like painful, like that's how much in pain I was. I was just like, no, this is not right. I can't do this. Also, you know, if you're going to Mia Aesthetics, they only give you 12 Percocet. By the time you come home, you'll probably run through them. So I did go to the hospital. They gave me a Percocet, but then they prescribed me like some muscle relaxers. I forgot the name of it, but they gave me, it was a sort of painkiller. So that's something you may want to do if you feel like you just can't handle the pain. Go to the emergency room and maybe, you know, tell them like, I can't, it's too painful. So yeah, and someone else said they're getting a BBL. I know the pain is crazy. Did you try not to sit directly on your butt? Do you think that affected results? So no, don't sit on your butt for the first 6 weeks. I literally didn't sit on my butt for the first 2 months. I'm now sitting on my butt and I'm about 12 weeks post-op. So don't sit on your butt for the best results. I mean, you won't want to sit on your butt because it's going to be swollen and it's going to hurt you. Like, so you won't be able to sit on it. And how I slept was, you know those big donuts that people put in the water, like you sit your butt in it and your butt is kind of hanging out at the bottom. So that's what I slept with, and I literally had every single pillow in the house. Yes, I had like 15 pillows. And my boyfriend was like, do you really, like, is it necessary? Like, I was like, yes. Like, I gave him like one pillow. I was like, I need all of these. So I had pillows behind me, and I propped pillows up under my knees, because if you do have to be in a sitting position, propping pillows up under your knees takes some pressure off of your butt. So yeah. And the next slide, I'm gonna just show you guys the videos that I'm talking about. I want you guys to see the process. So just, you know, and if you guys are following my journey, you'll now get to see 5 days to 2 months, and then it'll be 3 months, you'll see 4 months to 6 months. So I'm so happy with how it improved from day 5 to 2 months post-op. So I'm so excited to see what it's gonna look like at 6 months post-op. And literally your body changes every day. You feel more loose, because if you had a tummy tuck, you're gonna feel really stiff and stuff. So just try to, you know, work out, walk, move, stretch, once your incision is fully healed. So yeah, there's the next slide. And I think after the next slide, that's it. I'm gonna wrap up the video with some pictures. So thank you guys for watching. Like, comment, subscribe, and just ask me questions. Tell me what you guys want to see. Do you guys want me to record a full massage session with my masseuse when she comes to do my post-op massages? Do you guys want to see like a really good video of that? I can do that for you guys. Let me know what you guys want to see. And thank you guys for watching. And so this is the area I wanted to show you guys. I'm gonna post the before, and then you guys will see this after. And this is just 2 months later. I want you guys to just see how horrible it looked 5 days prior, well, 5 days after post-op, and then how it looks now. Amazing, complete different results. You can see. Definitely totally starting to heal. Yeah, so I'm very psyched about that.